Hi, I am Dr. Kumar, anesthesia consultant practicing in Jayanagar Cloudnine and Kanakpura Cloudnine. So what is an epidural anesthesia? Epidural anesthesia is a regional anesthesia. This tends to numb the nerves that carries the pain stimulus from the birth canal. So the procedure of epidural. So initially we assess the mother's health conditions. Next we go through the blood investigations. Also we obtain the previous surgical history. Once we see the patient's skin over the spine, also we inquire about any cross spinal abnormality. Next, the mother is counseled about the procedure. Once this is done, then we establish an IV line into the arm, and after this a multi-parameter monitor is attached to the mother. The entire procedure is done under very strict aseptic precautions. Then one of the spine space in the lower back is selected and a local anesthesia is given into the spine space. Once it is done, then with the help of an epidural needle, the epidural space is identified. Once the epidural space is identified, through the epidural needle, a catheter, which is nothing but a thin tube, is passed through the needle and the needle is taken out. And the catheter is fixed on the back with the help of certain plasters. Then a test dose of a local anesthesia is given in order to confirm the epidural space. Once this is done, then the diluted dose of a local anesthesia is given through the epidural catheter. It takes around 15 to 20 minutes for the pain relief to be attained. After this is done, the patient might experience little bit numbness, shivering. This is all temporary and it tends to settle down. Also, in a few cases, there might be a drop in blood pressures, which is always corrected with the help of the intravenous IV fluids which is given. So what are the pros of an epidural? The epidural is one of the most effective method in providing a pain relief compared to any other formats of pain relief. It is safe for the baby since it's being a regional anesthesia. Also, it gives a painless labor in the mother. It tends to encourage the mother to go through a normal delivery, and it reduces the stress in the mother. When the stress in the mother is reduced, it also reduces the stress in the baby, and it is very beneficial when the pregnancy is associated with a hypertension or the pregnancy is associated with certain heart problems. The cons, if you look into, sometimes it requires the patient cooperation to do an epidural. As the patient is in pain, so they expect the patient to be constantly moving. So it requires the patient cooperation to establish an epidural. There are failure rates epidural. Certain times the epidural won't work. Around 3 to 4% it won't work. Then sometimes it so happens as the mother won't be able to push out the baby effectively. So there is a chances of requirement of an instrument in order to aid the delivery, like usage of vacuum or forceps. Then few side effects, though rare, but like headache. These headaches are initially managed with the help of IV fluids, bed rest or painkillers. Suppose it doesn't settle down, then we give what is called as the epidural blood patch. Then other side effects which can be seen is infection or the bleeding which can take place. These are very rare but still to be mentioned. So yes, if you ask is it safe enough and do you require, it depends upon individual's pain threshold, and this epidural is one of the best method for the pain relief.